Modern life is very stressful, so anxiety is an innate part of the modern condition. And we're all quite used to those feelings of feeling acutely anxious before, say, job interviews or generally worrying if things are going on at home. But for many of us, anxiety becomes more intrusive in our lives. Can you imagine a situation, for example, where your life was being destroyed by recurrent panic attacks, where you never knew where they were going to strike? This awful feeling that you were going to die, that you were going to lose control. Or that your life was being taken over by phobias, where you couldn't go into, say, hospitals or lifts or supermarkets or crowded areas, where you struggled to get into a car, where you struggled to drive in the motorway or get on a plane. Can you also imagine what your life would be like if, for example, every time you went into a social situation, you became incredibly anxious and incredibly embarrassed and really didn't know how to cope with these? So these were the questions that I asked myself really when I was writing Anxiety and Panic. How best could I teach people skills to actually deal with these very, very common and very simply manageable conditions? So, for example, I looked at how the brain can be changed by our mind. So that's an extraordinarily powerful concept. So we can actually use our mind to reshape key pathways in our brain to reduce our anxiety for our life. Panic attacks are simply caused by a little organ in our emotional brain called the amygdala, who I call the gunslinger. And this guy is in charge of your stress system. And unfortunately, his normal role is to look for danger in your environment, internally or externally, and fire off bursts of adrenaline. And all that happens in a panic attack is that we're getting these bursts of adrenaline, which are giving you all these acute physical symptoms, but we don't know how to deal with them. And something very similar is happening in phobias, where we're also shooting off large bursts of adrenaline when we're exposed to particular situations. So the really good news is that we can clear your panic attacks very, very quickly, often within 1 or 2 sessions, and teach people how to, for example, overcome the phobias that are creating so much difficulties in their lives. We can also teach people through very, very simple techniques to clear social anxiety in all its forms, whether it be that you're anxious when you go out, say, to a local party or pub to meet a few friends, or whether you're struggling with, say, performance anxiety where you have to give talks or speeches. The good news is that we can teach you skills to very quickly eliminate these conditions out of your life. And then we have the whole area of what we call general anxiety. This is where we spend most of our time catastrophizing and worrying about what might happen, not about what has happened, but what might happen. And because we are spending so much time worrying, we're ending up pouring out a lot of adrenaline and glucocortisol into the body. And the good news is that without any medication, using very simple techniques such as mindfulness and simple CBT techniques, we can show you ways to seriously reduce your general anxiety so that your life can go back to normal. So we take an overview of the whole area of anxiety. In general, it can be either acute, like panic attacks or phobias, or it can be more chronic or general, like social anxiety and general anxiety. And we also have 2 other conditions that we deal with. Post-traumatic stress disorder, where people may have these constant traumatic feedbacks and flashbacks and panic attacks and depression. It doesn't matter how many years you've had panic attacks. This book will show you how to clear them for life.